Hello everyone, I hope you all are doing fine. Welcome back to my second video on community medicine. In this video, we will discuss previous year questions on concept of prevention. Let's get started with MCQs. First MCQ is consider the following statement. The people should seek to preserve their traditional eating patterns and lifestyles associated with low levels of coronary heart disease. Which level of prevention is implied in this statement? First option, A option is primordial, B option primary, C option secondary, and D option tertiary. In this MCQ, it is stated people should seek to preserve their traditional eating patterns and lifestyles associated with low levels of coronary heart disease. Here you can see we are trying to prevent emergence of risk factors. We are preventing unhealthy behaviors like high fat, high sugar intake and sedentary lifestyle, etc. So here the correct option is primordial level of prevention. So option A is correct. Second MCQ is, in a recent community health survey in Rajasthan, India, a significant rise in oral and lung cancer cases was observed, primarily linked to tobacco use, both through smoking and chewing. In response, the government introduced legislation aimed at reducing tobacco consumption. This intervention represents which level of prevention? In this case, legislation aimed at reducing tobacco consumption. Which is the primary risk factor for oral and lung cancer. And primary prevention is defined as action taken before the onset of disease which removes the possibility of disease in future. So in this MCQ, government aimed at reducing tobacco consumption, which removes the possibility of oral and lung cancer in future. So the correct answer is primary prevention. So option B is correct. Next MCQ is, a child is diagnosed with rheumatic heart disease. Penicillin injection prophylaxis is administered as part of the treatment plan. Which level of prevention is being applied in this case? Here in this MCQ, we should focus on this part. Penicillin injection prophylaxis is administered as part of the treatment plan. Here the child is already diagnosed with rheumatic heart disease. This prophylaxis prevents the recurrent attacks of RHD in future. This prevents recurrent attacks of RHD in future. So here the level of prevention is secondary prevention. Mode of intervention in secondary prevention is early diagnosis and treatment. So the correct option is C. Fourth MCQ is, regular hand washing to prevent the spread of COVID-19 is an example of which level of prevention? Here, regular hand washing Regular hand washing reduces the COVID-19 transmission and preventing COVID-19 infection. This involves measures are taken to prevent the onset of disease. So it prevents onset of disease. So it is primary level of prevention. Option B is correct. We can summarize the various levels of prevention by sequence of events like firstly the person will be healthy, then there will be emergence of risk factors, after that it will lead to the disease. Initially it will be in early stage, if it is not treated on time then it may progress to the advanced stage, and if it is still left untreated then it may lead to the disability. So if we are trying to prevent the emergence of risk factors, then this is primordial level of prevention. If we are trying to prevent the onset of disease by modification of risk factors, then this is primary level of prevention. If we are trying to prevent the disease progression to advanced stage by making early diagnosis of treatment, then this is secondary level of prevention. And if we are trying to limit the disability, then this is tertiary level of prevention. Thank you so much for watching this video. I hope it helped you understand and revise PYQs on concept of prevention. If you found it useful, don't forget to like, share and subscribe for more videos on important topics. Stay tuned for next video where we will discuss concept of disability in detail. See you soon.